Alzheimer's disease is a condition that affects over 55 million people around the world, and every 3 seconds, someone new develops dementia. For a long time, diagnosing Alzheimer's was mostly based on observing symptoms, making it more of an art than a science. But now that's changing rapidly. Thanks to advances in biomarker-based diagnostics, we're entering a new era in how we detect, predict, and track the progression of Alzheimer's. So, what exactly are biomarkers? Simply put, they're measurable indicators in the body, like certain proteins, genes, or signals from imaging scans, that reveal what's happening inside us. In Alzheimer's, there are 3 main types of biomarkers that doctors look for. The first is amyloid-beta, which forms sticky plaques between brain cells. The second is tau proteins, which create tangles inside neurons. And the third are neurodegeneration markers, such as neurofilament light chain or signs of brain atrophy seen on MRI scans. These biomarkers are crucial because they help confirm whether someone's cognitive decline is truly due to Alzheimer's. Even more importantly, they can detect the disease years before any symptoms appear. Traditionally, testing for these biomarkers involve PET scans to visualize amyloid or tau buildup in the brain, or analyzing cerebrospinal fluid through a lumbar puncture. While these methods are accurate, they're also expensive, invasive, and not practical for routine screening. That's where blood-based biomarker tests come in. Thanks to ultra-sensitive technologies like immunoassays, mass spectrometry, and Simoa platforms, it's now possible to detect tiny amounts of tau and amyloid in the blood. Imagine being able to identify Alzheimer's with just a simple blood test. Companies like Quanterix, Fujirebio, and C2N Diagnostics are leading the way, making early Alzheimer's screening as straightforward as checking your cholesterol. This innovation is fueling a rapidly growing market. The global Alzheimer's biomarker-based diagnostic market is expected to expand significantly between 2025 and 2035. This growth is driven by the rising number of dementia cases, increased government funding for early detection, and the integration of biomarkers into clinical trials and treatment approvals. Recent breakthroughs are shaping the industry even further. In May 2025, the US FDA approved the first blood-based Alzheimer's test, offering a faster and more affordable alternative to PET scans. The Alzheimer's Association has also released its first clinical guideline for blood-based biomarkers, giving doctors a clear framework for using these tests. Meanwhile, new research is making tests even more precise, and AI-driven imaging tools can now classify Alzheimer's stages with remarkable accuracy. Of course, there are still challenges ahead, like standardizing tests, managing costs, and ensuring access for everyone. But one thing is clear, biomarkers are transforming the future of Alzheimer's care. With earlier diagnosis and better tools, we're moving from reacting to Alzheimer's to anticipating it. And that brings hope for millions of people and their families. If you found this video helpful, don't forget to like, share, and subscribe for more insights into the future of healthcare innovation.